Hi, good afternoon. This is the healthcare technology session, and we're going to take around 40 minutes to go over this 2021 healthcare situation. And after that, we're going to take 15 to 20 minutes in interactive session between you and the panelists. So let us jump in straight to the topic. And we have James here. He is from the venture capital, Core Capital. And I want to ask you and introduce yourself as well about your actions that you're taking in this healthcare sector.
Yeah, thank you very much. So I'm James from Coral Capital. I am probably the least qualified to be talking about healthcare on this panel, but hopefully I can give an angle from the eyes of a venture capitalist. In terms of like what we're doing in healthcare, and I think you mentioned data as well. We have made quite a bit of investments in startups in the healthcare space in Japan. Some examples are CAPS, which is like a digital full stack clinic provider. Another one is Provigate, which is basically non-invasive home glucose monitoring, as well as Kakyashi, which is like a SaaS solution for pharmacies, and a few others as well. And so we've made a number of investments in healthcare in Japan. The reason we really like healthcare is because there's just so much more to do, and there's so many important problems to work on. And it's one of those areas that, because of the structural and regulatory barriers, it's one of those things that are very hard to go like cross-border. And so you kind of have to build a lot of those solutions at home. Of course, on the science side and on the deep tech side, of course, there's a lot of cross-border opportunities, but I think a lot of the homegrown solutions also offer a lot of opportunity. And so that's why we made a lot of those investments. Another thing that we've done in healthcare that is potentially interesting to this audience, in partnership with our portfolio company CAPS, we were able to vaccinate 20,000 people within the startup ecosystem in Japan. So I'm not sure if everyone remembers, but at some point there was a shokuba seishu, so workplace vaccination program that was offered for big companies that had the resources to be able to do the logistics for that. Unfortunately, that left small businesses, which include startups, kind of in the dust and not able to provide the same things for those employees. And so one thing we were able to do is, in partnership with our portfolio company, we were able to gather the resources across, and also understand the vaccination needs for not only startup employees but also their families. And over the course of about 2 months this year, we were able to vaccinate 20,000 people. So, and I believe you're vaccinated as well.
Yeah, right. And I'm an entrepreneur myself, and I run a startup healthcare company, ILIS, and ILIS has joined the program. So we were one of the 20,000 people vaccinated. So please give a big applause to James for contribution.
I can't take credit. My associate Miyako actually led the drive, so credit to her. Yeah.
Thank you, James. And I was going to ask the audience, how many of you are from the healthcare sector? Please raise your hands. Yeah, like 1/4. Thank you. And how many of you are from the government or the public administration sector? Not many. And how many of you are from the startup ecosystem, maybe? Thank you, a couple. Okay, then I'll hand over the question to Masayo-san. Could you please introduce yourself and your actions or the initiatives that you or your company are taking?
Okay, thank you. I'm Masayo Takahashi, president of the Vision Care Incorporation, and I'm an ophthalmologist. And I was a project leader at the Riken Institute. That is the basic research center for 15 years or so. So, and now I have a company. I have companies for the gene therapy and the cell therapy development. So I went through from the clinic to the basic research and the business field now. I'm a beginner as a business person, but I saw all the aspect of the treatment development. And especially the gene therapy and the cell therapy is a very new field. And the progress of the science is so rapid in this field. So I feel a little bit or a big discrepancy between the social system or regulation with the from the science progress. So always a new science technology came up and innovation occurs. But I feel now the social invention or social science invention should be alongside with those innovation. Otherwise, we cannot utilize those very good technologies for social or patients. And especially the cell therapy, it's different from the small molecule because in the small molecule field, the end product is the treatment. Once the company produce the end product or get the approval, it can be a treatment. But the cell therapy is totally different. Even though you have the cell end product, you cannot treat patients. There's a gap between the end product and the treatment, like a gap between academia and the company. So we should conquer the gap from the end product to the treatment. And also we made a Kobe Eye Center because of the because I think the medicine will be changed dramatically within 10 years with the AI and such technologies. So I made the new hospitals in Kobe to make a new medical system. And in there, I think the total care of the patients will be important in the next generation medicine, not only the disease care. So I made total different system there, and I made a company alongside. So it's a very good, and I expect very good chance to the medical and the business scene. Thank you.
Thank you, Masayo. You work in so many fields, different fields, and I believe that you have done the world's first transplantation of retinal cells using iPS cells. Right?
Yes. Yes.
So what are the proportions of your the several businesses? You still work as an ophthalmologist, so you're running a company and you're building hospitals. Please tell us.
I'm still doing the outpatient clinic once a week because I should see the medicine from the patient or clinic side. Otherwise, the end product can not be utilized very well. But nowadays, I'm learning very much about the business now. So 60-70% business person.
Right, thank you. And now we can hand over the question to Yusuke. I know you have done a lot of work regarding data and technology, but not only in those fields, but also in the policymaking sector as well. Could you please give us a brief introduction of yourself?
Sure, thank you, Sho. My name is Yusuke Tsugawa. I work at UCLA as an associate professor. I am a clinician as a training. I do a lot of data science and AI and machine learning research. I make advice to policymakers in Japan and in the US. And I also serve as an advisor to a couple of healthcare startups companies in Japan. And I'd like to make a brief point about the fact that I think that healthcare, especially in the context of Japan and technology, is really exciting time of right now. Ever since I've been in healthcare for the last 15 or 16 years. So, you know, healthcare, AI, innovation, health startups has been a global trend in the US, in Europe, and also in Japan. But I think the difference here is that economy in Japan is not growing as much as we like to in the last 20, 30 years, but we still have the longest life expectancy in the world and also the longest healthy life expectancy in the world, like for the last 10 or 20 years. And this is like a quite amazing, unlikely thing that, if you think about Japan as number one by Professor Ezobogo, it's been a while since we lost a lot of number one labels in the global scale, but we still stand as a top player in terms of health and healthcare. So, but there's a lot of unknowns as to why Japan is doing so good in terms of longevity and healthy life. And I think the world is looking at Japan as a role model for how health and healthcare can be creative and innovative. So I think, and there are a lot of innovative startup companies in Japan, and they haven't been like become global companies yet. But I think I'm envisioning a lot of growth in that field in the next 5 or 10 years. I hope I can convince a lot of business people in the field like this is like exciting, at least in the context of Japan. In terms of research, I primarily work on 2 domains. And the first is to use innovative data to understand the performance of healthcare providers or physicians, nurses, and whoever is providing healthcare. Although many patients care deeply about the quality and the value of the healthcare they receive, not many people have access to valid and reliable data on how healthcare providers perform. It's really hard to understand who's a good doctors versus bad doctors. And my research team compiled innovative data on how individual physicians perform, including their patient mortality rate, complication rate, and cost of care. And I believe that improved transparency in terms of the data in healthcare will empower patient and healthcare. In terms of creating the data, in the US, we purchased the data from the Medicare, which is government data, and linked that with the data we got from the startup company, and creating a lot of database and evidence from the data. And I think it's quite interesting to see how data from different sectors of the field can be linked. And I think there's a lot of room to grow in terms of how private companies' data can probably be linked with other government-owned data in Japan as well. The second domain is to understand and clarify how AI, we talk about AI a lot, but how AI can actually transform healthcare. And one innovative angle I'm thinking of using AI and machine learning is to identify a group of patients or people who benefit most from treatment. The healthcare has historically been kind of dichotomizing the population into 2 categories: people with and without disease. And however, if we can utilize the data more, I think there's more room to understand about exactly who's benefiting more. Because the reason why we're dichotomizing those people is because there's limited data and understanding about who have disease versus not. So if you think about diabetes, we have one threshold, hemoglobin A1C 6.5. And as long as you go 0.1 point above the threshold, you're diabetic, and 0.1 point below the threshold, you are normal. And I think that creates a false perception that your risk is dichotomous as well, but it is not. The risk of having adverse health outcome is always continuous. So that was somehow we used it because that's the only way we can operationalize who to treat versus not. But because that's the problem with the data and how we can interpret the data. But with big data, with AI, I think we are at the stage of understanding exactly how individual level benefit of the healthcare. And I think those kind of creative way of using AI dramatically transform how we think about disease as well. Who's have disease versus not, who is normal versus not, and those kind of way. AI is just a tool, so you can use it in different ways. But I think AI, in terms of healthcare, is more powerful than what we think right now. So I'm looking forward to see more creative evidence coming out of the data science and healthcare AI in the next 2 or 3 years.
Yeah, very interesting. And we're certainly going to come back to the point of AI, longevity, and the regulatory process that Masayo pointed out. But first, we'll have to go through the COVID-19 problem. You know, this session is not a session of COVID, but it's an elephant in the room, so we have to go through the topic. But we would like to talk about the positive sides and the effects and the impacts that COVID has brought us. It's not always, we don't always have to be pessimistic. You know, it has brought about innovation. It has brought up us tons of data that we can utilize in the future. So maybe I'm going to ask Masayo first.
Yes.
Can you think of some examples of the positive effects of the situation?
Yes, first of all, the COVID gave us a big shock, right? So especially in Japan, we need such shock to change our mind. So it was good. For example, they know the importance of the medicine, and they want to know more about the medicine nowadays. And also they noticed the bad aspect of the Japanese medical system. As Tsugawa sensei said, the Japanese medicine system is quite good and it was world best. But nowadays, in some part, the collapse occurs in the medical system. And that bad aspect also showed up. But that's not bad. We can improve that once we notice it. So that's good. And we are ready to have a change, I think.
Okay, thank you.
Can I mention something on this point?
Yeah.
So, as Masayo-san was saying, the healthcare system in Japan is so good and so efficient to the point where it's not necessarily anti-fragile. And so when everything is as normal, then everything moves very, very quickly and it's very, very reliable. Now, the issue is when it's not as normal. So when there's chaos like a pandemic, that's when things start to break down. But it's within this chaos that great innovations are born. But specifically in terms of COVID's impact on healthcare, more broadly speaking, it's not so much that it's changed everything, so much that it's accelerated everything. So, you know, no one, I think hardly anyone in this room would think that, let's say like in 10 years or 20 years, like, you know, we're still, you know, not going to be using data-driven analysis for, you know, better patient outcomes and things like that. Or, you know, we're going to be like faxing like health records to some other clinic. Like I think a lot of us agree that we're probably not going to want to be doing that in 10 years, but because there wasn't this sort of like forcing function like the pandemic, we kind of like settled for that type of outcome, right? And then thanks to the pandemic, you know, you have all these things that were, you know, accelerated, both in terms of like demand, but also in terms of deregulation, right? You no longer had this sort of complacency to keep things the way they were. And so you saw, you know, deregulation and telemedicine, right? Both in the US and in Japan to a lesser extent, but somewhat in Japan as well. And then, you know, mRNA technology, like that's been around for a while, and you know, the pandemic was a forcing function to get it out there. And so the first major application is COVID-19, but obviously there's going to be many, many other applications for mRNA as well. And so that's just like open the floodgates for a sort of like Cambrian moment of innovation within the healthcare industry at the intersection of technology. And it's not like mRNA is one huge innovation, but the sort of like broad changes are not due to any one particular technology itself. It's more so like the convergence of many different technologies, right? And so, you know, you have, for example, the proliferation of smartphones led to, you know, much cheaper and much faster components, and you had, you know, much better sensors. And so now you have much better data, and because there's telehealth, things are naturally logged into some sort of system that's more interoperable. And then based on that data, you can have, you know, artificial intelligence making better decisions or enhancing diagnoses for doctors, things like that. But that's also something that probably you can talk about, Sho.
Yeah, thank you. I was thinking of the word that you brought up, the anti-fragile. It comes from the economist Nassim Nicholas Taleb. And I was thinking of the same thing in the AI field, right? My company, ALIS, develops AI, healthcare AI, but the word AI has been a buzzword. You know, the doctors been talking about AIs, it's gonna overperform human doctors. But, you know, opening the box, those kinds of medical devices are not performing so well in the real world, well, as for now, right? So the new word for that AI is awaiting is robustness. And it seems the same for me, you know, when Japan is doing good, we're doing good. When the AI is used in a proper manner, it's doing good. But when the situation is completely different, you know, the AI isn't so robust for now, so we can't make better use of it. And it's a great point that you brought up. And do you think we, Japan, are going to cope well with this situation? You know, because after the bubble collapsed, we haven't been doing so well. We've had these 20 years of static 20 years. What is your opinion?
I certainly hope so. I mean, yeah, this is a topic that I'd also love to hear from Masayo and Yusuke as well. So in the technology industry, you know, the pace of innovation is so fast, and in fact, it's accelerating, right? And of course, you have like, you know, Moore's law and like lots of other factors that have contributed to that. And when it comes to industries like healthcare, because you have literally people's lives at stake, obviously people are going to be more cautious when implementing these new technologies, even though we might all know that they exist and they're probably better than what we currently have. But it's risky, right? But now what you're seeing is that because you have this intersection of, you know, existing discoveries in science, but also on the technology side, particularly like in bioinformatics and computational biology, you're seeing that same sort of pace of innovation within healthcare. And mRNA is one of those examples, right? That was concocted in, you know, a matter of days for the COVID vaccine. But regulation is not keeping up, right? Not keeping up with the pace of change that you're now seeing in the healthcare industry. And so I'd love to hear, you know, maybe from Yusuke and Masayo as well, like how you feel about this sort of like gap between how quickly things are moving and also, you know, whether regulators can actually keep up, specifically, you know, within Japan.
Yeah, perhaps Yusuke, and then afterwards Masayo.
This is a great question that we have to think about in the next, you know, upcoming 5 years, I would say. There are two different ways of thinking. One, in terms of like basic drug and medical device development, like mRNA vaccine. At least for this COVID-19 pandemic, we would have to be, you know, understand that we did, you know, at the global level, we did a great job. You know, we did way better than what we were expecting. So, you know, the shortest time period since for the development of any vaccine was 4 years historically. And that was our initial expectation for the COVID vaccine as well. But it ended up, we got the vaccine within 1 year. And that was a great success to be, you know, to a lot of the US companies and the government, I would have to say. Given the global economic damage of the COVID-19 pandemic was estimated to be like $6 trillion. But government, US government invested in like 18 to $23 billion just for the development. And they did a lot of deregulation in terms of the COVID vaccine. You know, they changed a lot of rules in a week or two to make sure that the vaccine can be developed faster and can be disseminated faster. And that was a great job. And I think a lot of other nations globally is benefiting from what the US did. In terms of newer technologies that James has mentioned about AI and machine learning and the other things, it's more complicated because in many countries, they're trying to use the same kind of regulation process as like a traditional medicine and medical devices, but it's different because, if you think about traditional medicine and medical devices, there's basic science, understanding of how things might work. On the other hand, a lot of data science and AI is relatively black box. And that's the beauty of the AI, because if a human can create a certain algorithm, I think that would never be overperform what humans doing. But on the other hand, by utilizing the data that is above and beyond any human can understand and interpret, that will create a super performance that will potentially lead to improved health outcome. The problem is that we don't know exactly how the mechanism works. There's no underlying theory behind, if you think about AlphaGo and AlphaGo Mu and whatever, we don't know exactly why AI is doing better than human. So I think the regulators have to understand about we need a completely different approach to understand and approve any medical device or any treatment based on AI and machine learning. But I don't think many countries are well prepared for that. So we need better understanding, and we need more development in terms of how regulations should work, and that can be a major impediment or accelerator of the global competition, because we're not talking about internal within country competition. We're talking about any kind of global competition when it comes to innovation. So shows company Iris is competing with global AI companies, and if Japanese regulation in Japan is like hurdle for his company to be innovative and make growth, I think that will be really downside for his not only for his company. I think the ecosystem of the healthcare innovation in Japan, if you think about, we're competing with the US and China, and I think we need more better environment where we are supporting a more innovative way of creating healthcare solutions, and how, from academic point of view, how academia can collaborate and contribute to more innovative technologies.
Thank you, Yusuke. We each definitely have to work as a whole in our own fields. I work for the AI sector. Yusuke, you work for the AI and policymaking as well. And James, you work for the startup ecosystem. And Masayo, you were doing so well in different fields. Maybe you can share us your views regarding regenerative therapy or deregulation, or your concern.
Yes, about the regulation, as I said, everyone knows AI will change the medicine, and the medicine will be released from the hospital, I think, and it goes to each house. And in that era, the regulation, until now, the medicine is regulation first system, but it will be, or it should be, patient oriented. So the regulation should be changed, especially as Tsukawa Sensei said, that even under the same disease name, the patient's situation differ from patient to patient. So everyone says personalized medicine is important now. But about the cell therapy, we are saying categorized medicine, not personalized one person, but categorized. And the disease is a very ancient category. So now we are reconsider and change the concept of the disease name suitable for the cell therapy. Because the cell therapy is the end product will work differently according to the patient's situation, even under the same disease name. So completely we should think about the disease name and the medicine from the base. And Japan, we have a very flexible regulatory system nowadays and suitable for the cell therapy. So I made the company to utilize those systems and try to make the categorized medicine from Japan. And it's not the market oriented. So like a guerrilla, the very small market started, but gradually we will change the system, I hope.
Thanks, Masayo. The word you brought up, patient-oriented, is critical and essential. I love the word. Yusuke, could you please share us some of your inspiration regarding this patient-oriented way of thinking? We several changes may be awaiting us in the near future, maybe within 5 years or so. But what are some aspects that we as patients or citizens will be able to experience here in Japan or maybe globally?
Yeah, I think there are two components that is already affecting how healthcare functions, both globally in Japan. One is especially relevant in Japan is demographic transition. So a lot of countries, both in Japan and the US, are facing aging society and a smaller proportion of working population within the nation's population. And the one basic understanding we have to have is no nation in global situation have ever succeeded in controlling the healthcare spending growth. There's no role model. We can't rely on any existing model to control the spending. Meanwhile, making sure that we're making enough innovation so that future generation don't suffer from less innovative healthcare technologies. So we need more creative ways, because there's no answer we can rely on, to make healthcare and social security more financially sustainable. And we don't want to do it by cutting any benefit. We don't want less innovation. We don't want less benefit, harder to go to hospital. And I think, we do need technology. We need to rely on technology and innovation to make sure that the cost is rising less rapidly. At the same time, we don't have to make a compromise in terms of health and healthcare, because health ultimately is really one of the fundamental rights to humans, and I think fundamental value that people believe in. The second component, I think, is again going back to AI, and as Masayo-san, I'd like to echo what Masayo-san has mentioned, and I think there's a blurred line between healthcare and everyday health maintenance. So when it comes to treatment of diabetes, it is healthcare. You prescribe medication, you prescribe some kind of education for their diet and exercise. But if you're right below the diabetes threshold, and if you're starting to do exercise, or someone is giving some guidance in terms of the diet, this is not healthcare. We are again kind of dichotomizing between what's happening within the healthcare versus what's happening at home. And I think there will be, because of the AI and a lot of technologies we have these days, I think there will be more and more blurred line between those two, and a lot of what we think is healthcare will be something that people just use, like the app, like what they eat every day, and that will be the main point of the healthcare. And that will require, going back to the regulations, the changes in regulation. Otherwise, because healthcare is highly regulated market, we cannot just go ahead and provide any healthcare medications or medical device in any nation in the world. So, but we cannot have the kind of like a diet recommendation or exercise recommendations to be regulated, because that will be a lot of hurdles for the innovations. And that will also, impede the competition among the providers, of all the healthcare startup companies. So we need to change regulations and promote innovation competition. On the other hand, if we just open up all the regulation and anything can happen, the problem is that the users, consumers, patients cannot evaluate the value of any kind of healthcare technology that's provided outside of regulated market. So we need the new way of thinking, or the regulating, or even doesn't have to be regulation. It can be some kind of information or increased transparency or evaluation to make sure that the patient or users can understand the value of the new technology. And that will create a completely new way of thinking about health and healthcare. Because again, going back to what Masayo-san has said, it doesn't have to be within regulated market where people, government decide how much we want to pay, because again, that will lead to less and less competition. And, in a global and business field, I think that will make the business field of Japan less competitive at the global scale. So we think Japan should be more proactive. I'm talking about the government and regulations to make sure that we can compete with US, China, and other European countries.
So I'll just
Can
mention
I
one more
say
thing.
one more
Oh,
word?
Go
Sorry.
ahead. Yeah. Oh, okay. I'll be quick. Yeah. So I mean, what we call healthcare right now is actually just sick care, right? In a lot of cases, we're going when we have an issue, right? We have some kind of pain somewhere, we don't feel well, whatever the case may be. And that is going to be fundamentally changed by the, some of the things that were mentioned where you're, this kind of quantified self trend where you're able to have much better analytics on your body, right? What's going on. Now, as was alluded by Yusuke, the issue can be when you have all this information, both in terms of data and in terms of what you're Googling online, and you might be misinformed, right? And so this is issue. But this quantified self trend, what it can really sort of evolve into is quantified health, where that data can be provided to your physician and they can interpret it, right? And so when we talk about artificial intelligence, that's one angle, but really what we should be focused on is augmented intelligence, where we have much better information and it's not in these silos, at your health record at this particular clinic, and then your hospital has some other thing, and then you have your Fitbit or whatever the case may be, and all of that should be stored in one place for your physician to be able to have a much better picture on what's going on, right?
Yeah, please, Masayo.
Yes, sorry, but Tsukawa Sensei said very important thing, and I said the medical collapse in Japan, and it because of the we run the medicine under the socialist cost system, but by the hospitals that is run by under the capitalism, so that discrepancy or torture make the medicine collapse, because doctors will go to the easygoing and the less responsible and the well-earning field. So that should be changed. And the key point is how to do the business mind to the under such socialist cost system. So that should be invented in Japan. And also the AI is the key point that we can get the data. And the more the the business mind or system should be in the medicine in Japan, but we should do it very carefully, not within the regulatory system, but we should release it very carefully, gradually, but we need it, I think.
Yeah, thank you. And before opening up to the audience, I would like to ask a really brief question. Who should take leadership, or who should be the leader in utilizing data and this AI? There's not only one single answer, but maybe Yusuke, could you share your views?
That would obviously should patients, but the problem is the patients doesn't have a lot of patients doesn't have the resources and capacity to keep track of the data. So I completely agree with what James has mentioned. At one point, I was thinking about creating like a Dropbox for healthcare. Even in the US, it is really none of the healthcare data are not portable, and sometimes you have to pay to get your test results from the hospital. I personally think that it doesn't make any sense. On the other hand, a lot of nations like Germany trying to make the patients be the quote unquote owner of the data or the healthcare data. The problem is it's really hard for them to keep track of what's going on or interpret the results. So I think what Germany is trying to think about is to have like a third party, like financial plan, like a financial planner for your financial health. You need someone who can be your partner or consultant about your healthcare data and healthcare maintenance, so to speak. And I think that may lead to more innovative market. And I think that is exciting compared with what we're doing right now, where we, as a patient, or you don't have the data to your own healthcare information. And I think that is not only causing an issue about the business and the competition. I think that is actually hurting the health outcomes of the patient and empowerment of the patient. And I think there must be more better way to provide the healthcare and have access to their own health information.
Yeah, great point. Great point. And now let us turn to the audience. I know this is a very big topic, healthcare. So yeah, I'm sure there are a lot of questions. If any of you have interest or questions. Yeah, I'm going to take a few questions at a time. So first, the gentleman in blue suit. Okay, please go ahead.
Thank you very much for the presentation. I'm working for some startup company to develop medical equipment. So my question is, what would be your key success factor? What would be a roadblock to develop such a medical equipment here in Japan? Like in US, some startup already developed some medical equipment and get approval, FDA, something like that. But here in Japan, that case is super rare in my understanding. So what would be a key success factor?
Yeah, maybe first James and then to Masayo.
I'm definitely not an expert, but as a venture capitalist, milestones that I would be looking for is some clear path to getting the approvals that you need, whatever those may be for your particular device. And you in this area, unfortunately, it takes a long time to clear those hurdles. And you'll probably have to have a fundraising plan that is able to withstand the long durations for that. But unfortunately, I'm not an expert in this area, so that's all I could say from an investor standpoint.
What are some of the differences between the US and Japan in terms of investments for startups?
Specifically for medical devices? Yeah.
Maybe. No, but no.
Honestly, I don't think there's that much difference, to be honest. Yeah, I mean, we'd have to talk about the specifics of that business. So I believe it's too broad of a question to answer, sorry.
Right, thank you. Masayo-san, how about you?
Yes, the important point is that the end product will hit the real needs of the patient or doctors. And if you talk about it to the doctors and doctors excited, it's okay, I think. That's the point.
That's a good point. And actually that would be applicable not just to medical devices, but really any product that you have, you want your stakeholders to be really excited about it.
Mm-hmm.
Right. And maybe Yusuke, could you share your views?
I think there used to be a case that the time horizon for getting approval in Japan is way longer than the US. It is getting, the gap is narrowing over time. I don't think the time component is a major impediment in Japan compared to the US. As James had alluded, you need enough, it also costs money to get approval. And I think, the startup environment in the US, it's most of the time you can raise more money in the US and you have more financial resources to stand that, long and costly process of getting approval, whereas in Japan, it might be harder depending on how much money you can raise. Another component, when it comes to more innovative technology like AI and machine learning, again, going back to what I mentioned before, the government agencies are really struggling to understand about how they can approve the product. And the pricing, even if you get approval, the pricing is determined in a different part of the government and in different committee, and maybe you don't get enough financial return, or or the market might think that the pricing might be too high or too low, and there's a lot of uncertainty around what's going to happen. Whereas in the US, the pricing can be negotiated between the company and the payer and the healthcare provider. So there's more channel for startup to sell the product. So I think that is making it a little bit different. One last comment is, I think the US is moving towards a more population management model, where a lot of payment is kind of bundled. So whatever the route you take, they want the cost to be lower, and then the saving can be kept by the provider or the insurer. So that will make it easier for startup company to sell their products to any health system that they are looking for a way to save their money. Whereas in Japan, there's always a price tag, and you get paid based on what we call fee for service. So there's less room for those innovative products to go for different players in healthcare to make sure they can get enough funding. So that is, I think, making it a little bit harder because they have limited options. Just go to doctors and healthcare provider and government, and that getting the single price tag, and that is the only path in Japan. And maybe there might be a way to make it more diversified. That process in Japan will be, I think, beneficial for the healthcare startup and the business field in Japan.
Now we have already the system, but not many people and not many company are using it. And the regenerative medicine, the Society of Regenerative Medicine are trying to set up the insurance for the treatment by patient's own cost. So in several ways we are already have. So please think and utilize it.
Thank you. About the insurance, is that a public insurance or the insurance provided by the country?
Public insurance, the Society of the Regenerative Medicine are seeking for. So we have the tracks of the clinical trial and the national insurance way track, and also the clinical study and the advanced therapy track, and the treatment for patient's own costs. So there are various ways to reach to the treatment, and we try to make the public insurance.
Quite interesting. Thank you. So yes, maybe a gentleman in the second row, and then to the gentleman over there.
Hello, thank you very much for the great presentations. My question is about digital health and healthcare solution. And I think in Japan, really few number of people using digital health technologies. And then my question is, what would you think about the reason why people in Japan doesn't really want to use that kind of technology? And my hypothesis is that because we don't have a established, developed primary healthcare system. I mean, there's no primary healthcare doctor in Japan, and everyone has a free access to all the specialties, and that may discourage us to, how to say, rely on the digital health technology rather than we would like to go to the specialized doctor directory. So I really want to ask you guys comparing the US and Japan healthcare system.
Yeah, digital health. I'm gonna pass it down to Yusuke. But before that, the second question, please.
Okay, I have a question about data access. I think Mr. Tsugawa said that you can buy data from Medicare, but it's not all that easy to get data, compatible data in the US. My understanding is in Japan, the Ministry of Health and Welfare is sitting on a mountain of wonderful data. A friend called it Takarayama, but it's really, really hard to get access to any of it because they control it so tightly. How would you recommend that the Ministry of Health and Welfare change the access method to make Japanese startups, Japanese medicine, Japanese healthcare more competitive?
Thank you. A great question. To our popular panelist, Yusuke, could you answer the questions, please?
Sure. For the first one, for the digital health, I think there are two reasons why it may be harder for in the ecosystem in Japan is more tough. First is, the healthcare in the US is more expensive. So a lot of people are willing to pay out of pocket to get some kind of healthcare, digital health solutions, like, more exercise to reduce obesity, to better diet. These people are willing to pay. I've heard from a lot of startup company CEOs and founders that Japanese people are not willing, on average, are not willing to pay out of pocket. So the only solution in Japan is to reach out to either employers or the insurers who are trying to reduce the spending. And I think that model is like 2B model. And that, I think, is a huge difference in terms, because in the US, we can go either 2B or 2C because both of them are willing to pay for the healthcare solution. In Japan, there's only 2B model. We can be a reliable business model. And the other is, again, going back to what I mentioned about population health management. So in the US, again, US is trying to find out the way to reduce healthcare spending. And we're relying on a lot of population health management. So in the US, there's a model called Accountable Care Organization. That is basically, the system is responsible for both preventive and curative care to make sure that population they're managing is healthy and the cost is lower. And those are run by health systems and health insurance. And they are, because the goal is to reduce healthcare spending, they're willing to try out new healthcare technologies from healthcare startup companies, and they're going to pay for it. And they have a lot of financial resources to pay. So that is creating healthcare startup environment more robust because they have a different places to get the financial return from. In terms of the data, I completely agree. So the Medicare used to be only providing data to researchers. In the last 10 years, 5 years, I think they opened up. So now that even the healthcare startup companies can, under certain restrictions, can purchase the data from Medicare as well. And there are multiple options outside of health Medicare, like Optum Lab, IBM Market Scan. There are private companies providing data, and there's multiple ways for us to get the data from. And the data is created in a way that is easy to use for both the business and the researchers because they don't encrypt every single variable. Whereas in Japan, where the data is basically so encrypted that there's no way we can link with other databases, or there's no way the important information is also excluded from the data. And also, I agree with you that based on the law, how the national database with the claims data we have in Japan became available for the researcher is restricting how the data can be used. And that is really hard. So we need a new regulation and law to make the data available for larger community and researchers and healthcare startup companies and any companies, because I think that that is fundamental and that is so critical for not only for the research environment, but for the business development in Japan to be competitive in the global scale. Because compared with China and the US, we don't have the data we can use to create new algorithms using AI or machine learning, and that is really a critical problem we are having. So we need like policy makers to work on it. That's my view.
Yes, thank you. And we're probably gonna take one last question. Yes, gentleman in the last row.
Hello, thank you for your presentation. My question is, with technology, a lot of technology is going open source. Do you see open source presenting like new ways to like deliver value in this kind of industry? Perhaps James, you might want to start this off.
Are there any specific examples that you're alluding to? Sorry.
I don't have any specific examples, but in terms of machine learning, for example, there's just so much out there right now, like on GitHub and all these other kind of open source platforms. So I'm just curious, like, do you see any trends in this kind of open source community?
Right. So on the, you're right, on the algorithm side, there's probably going to be, I mean, healthcare is just one category of that broader trend. One area that is, potentially an area of interest, we were talking about data, right, and portability. But obviously privacy is a huge issue. And so who is going to hold that data? Who's going to host that data? And so blockchain in particular is interesting in terms of like where you're going to, if you're going to have a distributed network to host that data. So those type of projects definitely on the radar. But specifically like open source projects in healthcare, not particularly like up to date on that. And I can definitely say that there's not a project in Japan like that at this moment. If there is, please let me know.
Thank you, James. And Masayo-san, do you have any comments regarding database or AI maybe?
Yes, I hope to, in Japan, we can use the database. But the government are thinking about it in the movement for the personal historical record is going on, I think. I don't know when it will finish. Yes, and about the open source, just related to the word, but developing the treatment, the license issue is a little bit problematic, I think. And that is like a money game now. And so the license fee is so high, so the market size is needed and the rare disease is ignored, or the treatment cost will be increased. So the open source, like a patent tool, is needed for the medicine, I think.
Right, definitely right.
Mm-hmm.
And I'm sure there are plenty more of questions, but yes, let's do that over the coffee break. So please join me in applause and thanking our guests. So thank you.